Hey everyone, it's Angela Ardolino with Your Natural Dog, and I have one of my favorite vets. And I mean, I say that I've only known him 6 months, but it was love at first sight. I met him at the American Holistic Veterinary Association conference. And I don't even remember. I think we sat at a table together and mentioned the love of cannabis and mushrooms and psilocybin, and the rest was history. I don't know. But man, does he have so much information and is always there to help. Dr. Bob Ulbrich is on today. I always mess up his name because I always call him Dr. Bob. But he's on today, and he's going to help us find some natural solutions to our dog's allergies, why some of the convention medicines that are out there are just terrible for our dogs and make things so much worse. So stay tuned. We're coming up next.
Introducing MycoDog, a line of mushroom extracts combined with adaptogens like ashwagandha, astragalus root, and Bacopa monnieri, made specifically for dogs. The mushrooms in our tinctures are grown in the wild in the Pacific Northwest and are triple extracted from the fruiting bodies of the mushrooms. These tinctures are meant to support dogs with dementia and canine cognitive disorder, breathing and respiratory issues, and autoimmune diseases and even cancer. Click on the link below to learn more about how MycoDog can help your dog live their very best life naturally.
Hey everyone, it's Angela Ardolino with Your Natural Dog, and I'm here with one of my favorite holistic vets, Dr. Bob Ulbrich. Did I say it right?
No, Ulbrich.
Shit.
It's all right.
Ulbrich. I always refer to you as Dr. Bob, so
right,
that's why I never said your last name. And then I was like, oh shit, I'm about to have you on my podcast. I should probably learn how to say your last name right. So I apologize.
No worries.
But it doesn't matter because you're still one of my favorites. So I'm just going to call you Dr. Bob because it's easier that way.
Works for me.
How are you?
I'm good. Good to see you, Angie.
You too. I'm excited to have this conversation with you because you've been in practice for how long now?
Way too long. I graduated in '86, so however 30 whatever years that is.
So I want to know what happened back in the day before some of these prescription medications existed and a dog came to you with allergies. You know, what would you do? What were you taught? What would you offer them? Because nowadays, a dog comes in and it's always diagnosed allergies. They never look at what's caused it. Not a holistic vet. I'm talking about convention, of course. Not even an integrative. I'm talking about convention. And they're prescribed this god-awful drug called Apoquel, which I remember learning about it, seeing how awful it was, seeing how it was hurting most dogs that it was coming into contact with. I remember bringing it up to Dr. Zach, and he's like, "It's a great drug. What do you mean? How is there anything wrong with it?" And I said, "Zach, it's look at the side effects and the cancer and the whatever." And he's like, "Wait a minute. Now it's fun because Zach's straight out of school. Zach knows Apoquel is something you're supposed to use for maybe 1 or 2 days in an emergency because you can't figure out what the heck's going on. So when he's learning that people are using this on a daily basis, he was blown away. So it's kind of funny. He's trained conventionally new. How did you see this come into the market and go, what? Like, how did you deal with allergies back then?
Yeah, well, I mean, back in my day, what we were taught was to use steroids, which really aren't any better. They're prednisone and things like that. They're just suppressing the immune system. If you don't have an immune system, you can't show symptoms. If you don't show symptoms, you look like you're better, but you're not. And when the steroids wear off, they've had an impact on the immune system, and so they typically are even more allergic or more whacked out than before you started. So temporary improvement at the expense of long-term health. And of course, it's not just the allergies, but you need your immune system for a lot of things, and so more prone to infections and more prone to developing whatever tumors or what have you if you don't have an immune system. And in an effort to find an alternative to steroids, they've come out with things like Apoquel and Cytopoint and things like that. And yes, great that they're trying to find an alternative. Unfortunately, the alternatives really are not any better side effect wise. In fact, often even worse than the old steroid route. So, even on their package insert, if anyone bothers to read it, they list vomiting, diarrhea, but lumps, both malignant and benign tumors, and decreased white cell count, decreased neutrophils and monocytes, and increased chance of skin diseases or skin infections.
And you better make sure your dog is healthy and doesn't have cancer, because it's most likely going to make the cancer and whatever is wrong with your dog even worse.
Yeah. If they've got cancer, it's like throwing gas on a fire. If they don't have cancer, there's a good chance they'll develop it. So, yeah, okay, they're not itchy, but is that a good trade-off? I'm not thinking so.
I don't think so, too. And so do you see that you're finding, do you have patients that come to you that are trying to get their dogs off of Apoquel?
Absolutely. Off of Apoquel, off of steroids, they're looking for a better approach. The whole Western medical approach to allergies is, like I said, to suppress the symptoms. And symptoms are like the oil light on your car. If it comes on, you can either add oil to the engine or cut the wires leading to the light. Things like Apoquel, steroids are just cutting the wires. You're not, doing the body any actual good. So, we try and get at, what is the cause of their inflammation, and help support and heal their immune system, not suppress it. Sometimes it's a longer, harder route to, certainly, steroids, Apoquel, whatever. It's quick, it's easy, and in the short term they look better. And so, there's clearly a draw to using those things. But if you want good long-term health, you need a better approach, and it may take longer, and it may be a harder road to travel. But you got to look at their diet. You got to look at, what are you putting into their bodies? Are you over-vaccinating? Are you, suppressing whacking their system with flea treatments, or, heartworm, or preventative, or, there's all these chemicals and drugs that go into the body. Some are worse than others. Heartworm preventative isn't the worst drug in the world by any means, and if you live in an area with lots of heartworm, you might want to use it. But anything like that goes into the body can have its own set of side effects, and things sometimes just catch up with you after a while.
And I was going to say, I can imagine if they're coming to see you to get off of these things, and 9 times out of 10, they're getting off of them because they don't see an improvement. They see things get worse. I guess there'd have to be some sort of detoxification from the drugs, because then how the heck do you even know you're helping? Because now the immune system's been suppressed. So usually things get a lot worse before they start getting better, right? Because their immune system is going to hopefully come kick back on and then go, whoa!
Yeah, you can definitely get a rebound effect when you take them off, as it's been so suppressed for such a long time, and then when it comes back online, and they're way worse. So sometimes it's a tricky balancing act to slowly wean them off and try to support them at the same time. It's certainly a whole lot easier, to start off treating these things holistically than to undo the damage that's been done with the pharmaceuticals and then try and heal the immune system.
Oh, I hear you there. So would you say the biggest culprit is what they're eating?
That is at least 50% of the problem, absolutely. You wouldn't believe what gets into these dog and cat foods under the name meat byproducts. That can be feathers, hair, hooves, beaks, things that are totally digestible, but it tests out as protein. It can also include tumorous tissue that's been condemned from the human food line goes into the animal food line. Roadkill it goes into rendering plants and rendered into meat byproduct. Euthanized animals have ended up.
Animals that have been put
and
down.
They don't necessarily
have been put down and have the drugs still
in
them. Yeah.
Maybe the intermedullary pins from a previous surgery, or the collar that they didn't bother to take off. So you got heavy metal toxicity, and the drugs that they were put down with, not only the drugs that the animal were on, but the euthanasia solution itself is in the veins, and they get rendered into meat byproducts. I mean, it's bad enough that you're feeding dead dogs to dogs, but the euthanasia solution and all the other stuff that's in there is, I mean, it's bad enough from a moral perspective or whatever to feed dogs to dogs, but physiologically it's not actually that bad. But all the drugs and chemicals and other things that get in there are definitely bad for their health.
And then baked at such high temperatures, and then all the preservatives and flavoring and coloring and all the synthetic shit that gets put on it so that the dog will actually eat it and it'll be shelf stable. I mean, we keep bringing up diet and food every single episode because, of course, it's so important. And those dogs, they're getting it from their diet. They're getting it from the chemicals put on lawns, cleaners that you clean your house with, the laundry detergent. They're being bombarded from it. So the last thing you want to do is put another chemical in them.
Absolutely.
That's going to cause them
and you got to
harm.
remember, these guys are a lot closer to the ground than we are. So if you put, the carpet cleaner or the lawn fertilizer or whatever, they're rolling on these things. They're walking on it and licking their paws. It's one thing if, we're walking on the carpet with shoes, but these guys are a lot closer to it.
So everything affects them. So what is kind of like the first step of when you see an allergic dog? What is like the first things you assess and go, okay, he's obviously having an allergic reaction. Let's
diet,
start
absolutely.
with.
We start with diet, get them off of the processed food. And I'm not saying that all processed foods have all that, the byproducts and the junk and the chemicals in there. There are certainly some good brands that, try and put out, a good product. But the best processed food in the world is still processed. And once you've canned it, kibbled it, cooked it, processed it, you've lost something. So I'm a big fan of feeding them food, real food, what they be eating in the wild, their ancestral diet, which is raw meat and vegetable matter. They're not eating grains in the wild. They're not opening cans and bags of things. They're not sitting around the campfire roasting their rabbits. They're eating it raw, and that's how they've evolved over millennia to process and digest these things. So they rely on the natural enzymes that are present in a raw meat that gets denatured and destroyed when you cook it, can it, kibble it, process it. And not to mention the other, glutamine and taurine and all these other things that get destroyed in the processing process. So get them off of processed food, at the very least, a freeze-dried or air-dried food, which is minimally processed. The only nutrient that freeze-drying really impacts is the water, which is arguably the single most important nutrient there is. You die of lack of water sooner than you die of lack of anything else. But, that's one that's easy enough to add back in. So, for travel or, because people don't want to, deal with the ickiness of raw meat, a freeze-dried product is fine. But, really a raw meat diet, and there's lots of ways to do that. There's lots of companies now that are making frozen raw foods that, that's getting pretty easily available all across the country.
So easily available. Some of the, oh my gosh, I already forgot. Wasn't it Mars just bought their first raw food company. So next we'll be having a podcast about what to watch out for with your raw food when it's owned by Mars. You know they're going to cut some corners there. I mean, it's amazing to me how many people think, oh shit, I forgot, the crap that's sold in the grocery store that everyone thinks is raw and it's deli meat.
Oh, yeah.
Fresh Pet.
Yeah. But, you know.
Yeah. I mean, that is just as processed. It's just in a different form. So people think that they're getting something fresh.
Right in the right. It's in the
right
title.
on
It
there.
must be fresh. It must be true.
There's pictures of meat and carrots, and you can actually see the carrots in it. So it must be good food. But yeah, everyone needs to understand that this is a kind of an unregulated market, that it's a big money maker, and people make lots of money by making these terrible foods. I just went to the Global Pet Show, and I cannot believe how many, every time I go, there's a new food brand or a new food concept. And there's, this is the one I like that I got this time. I got insect protein and vegan food, plant recipe, all kinds of things coming up now that I'm just like, oh my gosh, our poor dogs.
Yeah, again, they're not eating a lot of insects in the wild, so I wouldn't call that their ancestral diet or natural diet.
I agree. What are some of the other things that are affecting dogs having allergic reactions, or what seems like allergic reactions? You know, where what I see is the biting of the paws, you know, till they're red, maybe biting of the butt, which is often fleas, or flea allergy, where people go, I don't know what he's allergic to. And I'm like, fleas. No, there's no fleas on him. You're right. There is no fleas on him, but a flea bit him and he's having an allergic reaction to it. So what are some other things that you see that pet parents could look out for?
One of the most common things we see is ear infections. So here's people have their mast cells, which are the cells that produce histamine, and that, you know, we take antihistamines when we have allergies. We have our mast cells in our respiratory system, you know, eyes and nose, and so we cough and sneeze and have runny eyes when we have allergies. Dogs have their mast cells more concentrated in their ears, armpits, and paws. So when they have allergies, indeed, yes. When they have allergies, they get itchy ears, itchy armpits, they chew on their feet. And so the ears, when the ears are itchy and inflamed, they produce extra wax to try and soothe themselves. And then yeast come along and say, ooh, wax, that's a good food supply, and they start growing on the wax. The yeast are not the problem. If he's got a yeast infection. Well, they're just secondary opportunists. There's yeast everywhere. If they were the problem, we would all be having yeast infections all the time. It's when there's an opportunity for the yeast that they start to overgrow. So, conventional medicine will put these antifungal medications and things to kill the yeast. If you take away the yeast food supply, the yeast go away. So I'll typically use this enzyme-based product. Can we say brand names on this? I don't know. It's sure.
Especially if you like
it's
them.
called
Heck
Zymox,
yeah.
and it's an excellent product. It enzymatically eats up the yeast, or the wax. The wax, and then the yeast go away. I mean, you still have to deal with the underlying allergy, but for the secondary infection, that stuff works really well. So that's kind of like what we typically see with a lot of these allergies is they show up as a ear infection or itchy paws or. But they can be itchy all over and scratching themselves raw. These hot spots that they get, they're so intensely itchy, and the more they scratch, the more they itch, and it can be miserable for these poor dogs. And what's happened is their immune system has gotten sensitized, oversensitized. It's gotten whacked. What whacks the immune system? Well, really, one of the biggest things, besides all the junk that's in their food, is overdoing it with the vaccines. And I'm not saying, don't vaccinate, but the vaccines are so grossly overused. They're used way too young, in too many combinations with other things. and repeated too frequently. So dogs and cats, their immune system isn't actually even up and running until about 12 weeks of age. That's why they have the maternal antibodies, the antibodies from their mom's milk, until about 11, 12 weeks of age, because they don't have their own immune system running yet. So vaccinating them before that age, and most vets start vaccinating at 8 weeks or whatever. A lot of breeders say, oh, if 8 weeks is good, 6 weeks or 4 weeks is even better. And they don't have the immune system to process the vaccine. And so consequently, you need to repeat the vaccine over and over again until their immune system is finally mature enough to actually process it. Meanwhile, you're damaging the immune system as you put all these antigens into the system, and the immune system is trying its hardest to deal with it. So we let their mom's antibodies do their job, and then we start the vaccines single virus at a time. We'll start with a single parvo, and we give it with a homeopathic remedy to help keep side effects to a minimum. And then let them process that for a couple of weeks. Then we'll give them a single distemper shot. Let them process that for a couple of weeks, and then we run an antibody titer test, a blood test to check their antibody response to the vaccine. One vaccine of each, typically at the right age, without dumping a whole bunch of other things in there to confuse the immune system. They'll typically have a great response, and then we run that titer test periodically to make sure they're maintaining their protection. 9 times out of 10. Vaccinate them correctly. That way, with minimal vaccines, their immune system provides an antibody response for the rest of their life. Most dogs don't need the boosters, and yet everybody gets vaccinated with everything every year because 10% of them might need one of those things 8 or 10 or 12 years down the line. So that constant abuse and irritation to the immune system year after year after year is a big culprit in where a lot of these allergy issues have come from. So if you want a way to avoid the allergies, raw food diets, don't over-vaccinate, most likely you won't have the allergies develop. I mean, there's certainly still other, genetics that come into play and other things that come into play, but 90%, I would say, of the allergy problems could be avoided just by doing that.
I love it, and I practice that on my farm all the time. So it is definitely a true statement and something that can be achieved. I don't want to scare the listeners who have either are on a processed diet or have tried Apoquel or are on Cytopoint, which I know some of you are. So we're going to take a short break. When we come back, we're going to talk about the steps you can take to maybe detox and start that change, because you can repair their immune system, especially if you've got a young dog. You really can make a difference by stopping and detoxifying them now. So when we come back, we'll talk about that.
This is Blanche, and she's the most noodle-ish dog you've ever met in your entire life. She's just the most loved dog you've ever met, but if you leave her alone, it becomes a total opposite thing. Blanche has severe separation anxiety to the point where she will scratch doors down to the wood, bark all night, cry if you leave her for 5 minutes. I tried the collars, I tried the sprays, I tried thunder blankets. The only thing that's ever worked was CBD, and that's why I got started in this business. Our calm tincture is 550 milligrams of full spectrum CBD and lavender. It's the perfect remedy for separation anxiety, stress, or fear. I love my dog, and I hated knowing that she was home freaking out. So I wanted to find an all-natural way to do it, no doggy Prozac, all natural. And once I found CBD, there's no other option. CBD Dog Health, healing naturally.
And we're back with Your Natural Dog with Dr. Bob, and we're talking about allergies, how to stay away from Apoquel and Cytopoint. And I know a lot of you, are there any others? I mean, I know antibiotics get prescribed for everything. I just don't get it. It's really funny because, before I did this, I had a magazine, a family magazine, and I talked about the overprescribing of antibiotics on children on a regular basis. And now here I am working with dogs, and it's the same damn thing.
Yeah, and they do have their use. I mean, I don't want to say, oh,
your body,
never use an antibiotic. I mean, if you've got a kidney infection, yeah, it can be life-saving. But to throw antibiotics at everything that has an inflammation, the idea is, okay, inflammation equals infection equals needs antibiotics. It doesn't really pan out. There's lots of reasons to be inflamed. You can get secondary infections that have nothing to do with, or don't need antibiotics. You just take care of the underlying problem. So, and then the antibiotics, of course, don't care who they kill. They kill the good bacteria along with the bad, and you end up with dysbiosis and problems from using the antibiotics. So it's not that we don't use antibiotics. We just use them judiciously and, in cases where it's appropriate. Right.
And when they'll help. Yeah, when they'll help. So if we've got a listener who is on one of these drugs and wants to kind of get off of them, can we detox and can we rebuild the immune system? Absolutely. And then figure out what the problem is?
So there's a lot of things that you can do. First of all, I mean, stop the over-vaccinating, stop the junky diets and all that, because otherwise you're never going to really get anywhere. But as far as rebuilding, so you want to detox, support the liver, support the gut to detox, and there's certainly a lot of nutraceuticals and herbal medicines and things that can certainly help to do that. Milk thistle is very good for helping the liver to detox, for example. And there's glandular supplements like the standard process Livoplex I use frequently. But as far as helping to support the immune system, standard process, again, I've been using that company for 30 years. Before they even had a veterinary line, I was using their human line on animals. They now have a nice line of veterinary products, but I still use the human Allerplex for many of my itchy cases. And it's not going to take away the itch 100% like that overnight the way a shot of steroids will. But it is so much better for the immune system, and the effects are so much better down the line. So I use a lot of. It's a combination
of
nutraceuticals.
An herbal blend, is that what
they put a whole bunch of different things in there that help support the immune system. But they also make things like canine immune system support, which is a great product, and we'll often use that. I think the Allerplex is more, kind of specifically focused on how on supporting the immune system when it's imbalanced in an allergic sort of way. If you want general immune system support, I certainly use the canine immune system support product all the time. So there's products like that. There's also things like quercetin, which kind of acts like a natural antihistamine in a way. But
quercetin is in cannabis.
Speaking of which, that's another product that we use. Natural anti-inflammatories, such as cannabis. And of course, you have the premier company that makes the best product. No, I got to tell you, I mean, when I met you 6 months ago or whatever it was at the AHVMA annual conference. There was it seemed like about half of the vendors at were cannabis distributors, and I checked out most of them. Your company stood out head and shoulders above the top, above all the rest. You had more knowledge and had a clearly superior product to the others. So I really gotta hand it to you what you've done with the CBD dog health products. and I do use them all the time. Yeah, well,
Thank you. That means a
I
lot
mean every
coming
word of
from
it.
you.
We switched over from the cannabis product that we were using to yours, and not that other cannabis products don't have effects, or there's certainly some good in a lot of but. I've been super pleased with the results that we've seen, and I use a lot of the E's as a general anti-inflammatory.
Good.
And of course, the other products for with cancer and other conditions. So that's definitely a big part of my protocol as well. I'd say a lot of my allergy cases are. Respond to what I've just the diet and Allerplex and quercetin, fish oils, cannabis, things like that, can certainly help. There's certainly some cases that they've just been so whacked, or they're in such bad shape that we only get halfway with those things. So the other approach that I use is I will do allergy testing. I'll send in. It's a blood test that I use. VARL, Veterinary Allergy Reference Lab, is the one that I use, although there certainly are others. But I've had good response with these people. They do a variety of inhalants, grasses, trees, molds, pollens, human dander. Dogs and cats can be allergic to people, just like people can be allergic to dogs and cats. That's a particularly tough one to avoid.
Oh, I didn't know that.
Obviously, the food, do a food panel, and those are relatively easy to avoid in their food. Although, that doesn't cure their allergy if they've got a beef allergy. Avoiding beef doesn't mean that you're no longer allergic to beef. You're just not showing the symptoms. So it's kind of like symptomatic, treatment. But it certainly is good to avoid beef if you're allergic to it. Although, just getting back to the food thing again, part of the food allergy problem is that the food is less digestible when it's processed. When you destroy the enzymes, you can't digest those proteins down into small enough pieces, so they end up absorbing larger chunks of protein into their system, and it's the large chunks of protein that irritates the immune system. So if you could digest those proteins down to the little amino acids, those are too small to affect the immune system, and you can't be allergic to them. So that's why raw foods with natural enzymes is more digestible, less allergenic. And I've known dogs that had, say, a beef allergy that actually reacted to canned beef, kibbled beef, cooked beef, but handled raw beef fine. That doesn't always happen. Sometimes they're just so allergic to beef or whatever, even raw, they'll react. But it happens frequently enough that it really shows what a difference that the diet can make. But I digress. Getting back to the allergy testing.
No, I love it. It makes sense. So
Yes,
they get an allergy
avoidable
test, and then you can have some clue what to avoid. And this is after you've basically fixed the diet and gotten out maybe other chemical irritants, and we're not over vaccinating, and we're still having
Absolutely.
an issue.
You steer
then
away
this allergy
steer
test is going to kind of help
that's
you
a word.
steer away from some
But
things.
like if you've got a human dander allergy or house dust, you can put electrostatic filters on your furnace and try and keep the dust to a minimum. But realistically, how are you going to avoid the pollens that are just everywhere in the air in the spring, or the house dust or the molds that are just everywhere? In my part of the country, this time of the year, everything's moldy, so you just can't avoid it. So what do? Well, I will treat some of those cases with isodes, which are homeopathic preparations of the things that they're allergic to. And we have a whole all the things that this company tests for. We have homeopathic preparations of the different grasses, the different trees, and molds, and all that stuff. Even human dander. We have a homeopathic preparation of human dander, and we mix them all together with a.
So is that kind of like it's acting like a vaccine where you're taking a little bit of something so that the body learns how to like
I
react to
hesitate
it?
to equate it with a vaccine. But it is kind of the idea that it's helps the body to
True.
to deal with these things, without overwhelming it and
Figure out.
And
Okay.
we do a process that I've developed where you ramp them up. You start them off with 5 drops on the first day and 6 drops on the next, and you work your way up to 15 drops, and then you work your way back down to 5, and then maintain them at 5 drops a day. And I would say 2/3 of these really stubborn cases respond really well to that. Some of them you can't get down to 5. They're doing really good by the time you get to 15, but when you get down to 8 drops, they start getting itchy again, in which case, okay, you maintain them at 9 drops a day or 10 drops a day or whatever it is that keeps their itch under control. And it's a much better way, obviously, than trying to deal with these things with Apoquel or steroids or whatever. There's no side effects. It's not going to, and over time, it can actually cure the allergy. I've had cases where they were on these allergy drops for 3 years, say, and they were doing well, and then they start getting itchy again, and it's like, what's going on? Well, let's rerun the allergy test. Lo and behold, half or 3/4 of the things that they were allergic to, the numbers are much lower, but now they're unfortunately allergic to 6 or 8 or 12 other things. So we have to reformulate the drops.
Wow, interesting. How cool. That is very cool. So if someone's trying to find someone who's doing what you do, can they do telehealth with you? Can they contact you and do a consultation?
These days, we've had to unfortunately really limit our new clients, but we do have a waiting list that we're working our way through. We'll try and get you in when we can, but unfortunately, it's not easy. Well,
so if someone wants a vet like you, they love what you have to say. They love this. What are they looking for?
The ideal.
What kind of vet are they looking for? A homeopathic?
My biggest love is homeopathy, but basically someone who is thinking outside the box, doing more natural treatments, recommending raw diets, not over-vaccinating. Where are you going to find these people? Well, there's an organization called the Holistic Veterinary, or what's it called? The American Holistic Veterinary Medical Association, AHVMA.
AHVMA.org.
You go to AHVMA.org, and there's a Find a Vet thing you can click on for the different states. Now, that doesn't guarantee, just because they're listed there, doesn't guarantee that they're good or that they're even particularly holistic. They may have learned some acupuncture, but they're still, practicing pretty conventionally.
Exactly.
I mean, it's a step in the right direction.
And I like that you said that. I have a vet across the street, and she is listed on there, and she's called East West, and I can guarantee you there is no East happening over there. Like when I walked in for acupuncture, she was like, someone, do we do that still kind of thing? So yes, absolutely. It's a good start, but you still need to do your research, and you still need to contact them and ask them what you're looking for. And guess what? You want to get them off, Apoquel,
Absolutely.
That's a great call. They're going to love that call.
Another
when you say,
great source is
the
Academy of Veterinary Homeopathy.
And they'll be able to help you do it.
It's theavh.org, theavh.org. That would be specifically veterinary homeopaths, which I think are the cream of the crop. But anyone who's in that group, I think would certainly be very holistically minded and would be on board for the raw diets and all the things that I'm talking about.
I love that you're saying this because I'm sure there's some listeners out there who feel like they've tried everything, and I feel like this is something maybe they didn't even know about. So thank you so much for sharing. Those of you who do want to try CBD Dog Health's Ease for your dog, to see if that helps his allergies, we're doing a 15% off if you use the word allergy at cbddoghealth.com. And Dr. Bob, thank you so much. I'm going to have to find another reason to have
Be
you
glad
on
to be
again
on again and
because
see your lovely
you gave
face
us so
anytime.
much awesome information, and I appreciate you so much.